Well, last night we brought you the story from the Illinois State Ambulance Association requesting more money. That will be used to boost emergency workers' pay. The Department of Health Care and Family Services, in charge of issuing those funds, say money has already been given. Now it wants to know, where did the money go? Fox Illinois' David Pierce has answers from one Springfield ambulance company on how it says those dollars were not enough.
Raja, the department says it's doubled those payments to ambulance companies in 2019 and sent COVID-19 relief money in 2020. But one Springfield ambulance company says the money was, quote, well spent to keep employees on board.
So that money is not still there to be used. It's gone.
American Ambulance Services' Susan Zappa says the money HFS claims was enough has been used throughout the pandemic. Zappa says those funds were put towards higher wages and gear to protect employees while helping COVID-19 patients.
Additional personal protective gear, that was also part of that money. And we gave employees hazard pay because it was a very, very stressful time for them. And to keep them in the field, that was one way to keep them in the field.
And the list goes on. Illinois' minimum wage has risen, gas prices nearly doubling since the start of the pandemic, and companies have been picking up the bill of COVID-19 patients transported who don't have insurance or Medicaid.
Not necessarily. If they're not Medicaid enrolled, we don't get payment for it.
The pandemic has led to more of those patients needing to go to the hospital and Zappa's company having to exhaust more funds, which is why she believes the money the Ambulance Association is asking for is necessary.
You don't want us to go out of business because then there's not be anybody to transport people.
Just before this story aired, I received a quote from the Ambulance Association's president, Chris Vandenberg, saying, quote, in 2021, the General Assembly unanimously supported shifting Medicaid payments for ambulance providers directly from the state as a result of managed care organizations' years-long pattern of improper denial or payment delays. Since the shift in January, our members have experienced improved payment of claims, though ambulance providers are still owed millions of dollars from the MCOs for transports prior to the payment shift. It is time the state fully addresses the denials, underpayments, and administrative burdens that have worn away at our ability to care for patients, unquote. The full statement will be posted on our website, foxillinois.com. I will be working for you to get more answers from HFS to follow up on those claims of money being withheld. In studio, I'm David Pierce reporting. Back to you.